Cartilage. We all know that the skeleton is formed of two things. The previous videos we discussed together bones. The skeleton mainly formed of bones. And what are these colors? Blue color, red color. The skeleton formed of bones and the cartilage. What are the cartilage? The cartilage is a rubbery type of connective tissue, tough and resilient, has no blood vessels, nerves, or lymphatics. What is the nutrition if there are no blood vessels? Where is the nutrition? The nutrition of the cartilage is taken from the peripheral layer. Peripheral layers around the cartilage. We take before in the terms that around is peri. And the cartilage is called chondro in Latin. Therefore, around the cartilage there is a layer called perichondrium. Perichondrium containing blood vessels, containing nerves, containing lymphatics. The cartilage as a structure formed of mature cartilage cells called chondrocytes and immature cartilage cells called chondroblast. In addition to these cartilage cells, there are fibers and matrix. Cartilage resists compression and friction force. Cartilage has great capacity for growth by multiplication of chondroblast, which are immature cartilage cells. Therefore, growth of cartilage through multiplication of chondroblast, as we take before in the bone in this cartilage, which is called the epiphyseal cartilage, which is responsible for growth of bone in length. The chondroblast proliferate, and ossify, leading to growth of bone in length. What are the types of cartilage? The commonest cartilage present all over the body is hyaline cartilage, which is blue in color in this picture. The hyaline cartilage mean glass-like. Why hyaline cartilage is like glass? The matrix of hyaline cartilage is translucent, like glass. And the hyaline cartilage is the commonest type of cartilage present all over the body. Hyaline cartilage appear histologically. Hyaline cartilage appear histologically like that. Numerous is small, rounded cells. Numerous is small, rounded cells. And this layer around the pericardium we mentioned before is called perichondrium. Peri means around, chondrium means cartilage. What are the sites of hyaline cartilage? Remember with me, when we take the bone, we take the methods of ossification. What are the methods of ossification? Intramembranous, not important now. Intracartilaginous ossification is important now. We said before that most of the long bone, all long bones, develop by a model of hyaline cartilage appear in the fetus, and this hyaline cartilage replaced gradually by bone. Therefore, hyaline cartilage first of all represent the cartilaginous model in all developing bones in the fetus, which develop from intracartilaginous ossification. Sure, this is very important hyaline cartilage, which is the epiphyseal cartilage responsible for growth in length in long bones. Articular cartilage, all this cartilage in the joints, which cover the articular surface and called articular cartilage, is hyaline cartilage. This blue color, which called costal cartilage, and this cartilage, which called xiphoid process in the lower part of sternum. The sternum is formed of 3 parts. The lower part is cartilage called xiphoid process. Respiratory. Always remember respiratory in hyaline cartilage. First of all, cartilages of the nose, and this cartilage of larynx, all cartilage of larynx except epiglottis. Here it is green in color because it is not hyaline cartilage. The blue color is hyaline. And the cartilaginous rings in the trachea and the bronchi. Therefore, respiratory airway, starting from the nasal bones, nasal cartilages, until the trachea and the bronchi, except epiglottis. Therefore, the sites of hyaline cartilage, remember the fetus first, and remember intracartilaginous ossification. All developing bone from cartilage in the fetus develop first as a hyaline cartilaginous model. Never forget growth of bone, epiphyseal cartilage. Never forget articular surfaces, articular cartilage, and respiratory airway from the nasal cartilage to the tracheal and bronchial rings, except epiglottis. And never forget the cartilage which protect the respiratory passage. These are protection for the respiratory passage and all chest structures, which are called costal cartilage. Costal means ribs. The cartilage which continuous with the ribs called costal cartilages. Ossification of this cartilage may occur in certain sites. Sure, in certain age, ossification of epiphyseal cartilage. And in very old age, ossification of cartilages of the larynx. But this occur in very old age. This is the first and commonest cartilage present in the human body, which is called hyaline cartilage. Then we have another type of cartilage called white fibrocartilage. Why it is white? Because the matrix of this fibrocartilage is full of collagen bundles. Collagen bundles, white in color. Histologically, few cells of cartilage. Few cells of cartilage with many fibers in the matrix. All these fibers in the matrix are collagen white fibers. Therefore, this cartilage is white in color and called white fibrocartilage, full of fibrous tissue, collagen bundles. Ossification doesn't occur in this type, never. What is the example of the white fibrocartilage? The white fibrocartilage mainly present here. What is this? These are the vertebrae, and there is a cartilaginous disc between the vertebrae. When we take before in the terms, we said that inter means between. Therefore, cartilage between the vertebrae, this cartilage is called intervertebral disc. In this picture, the red color is the white fibrocartilage, which is the intervertebral disc here, intervertebral disc here. All these intervertebral discs are white fibrocartilage, and this also red. What is this red? The two bones on the right and the left side, these two bones are called hip bones, which form the main part of the pelvis, or form the main part of the bony pelvis. The two bones are connected together here by a piece of white fibrocartilage, and this fibrocartilage called symphysis pubis or pubic symphysis. Symphysis pubis or pubic symphysis. Therefore, the red color is the white fibrocartilage, intervertebral discs, and symphysis pubis. The last amount of cartilage is yellow fibrocartilage. The yellow fibrocartilage is yellow in color. Why? The matrix. The matrix is full, very rich, of yellow elastic fibers. Yellow elastic fibers. All these are yellow elastic fibers, and give this cartilage the yellow color. The yellow elastic cartilage show abundant, large cartilage cells. Abundant, large cartilage cells. What are the sites of elastic yellow cartilage? Palpate this elastic. The auricle of the ear. This is called the auricle of the ear. Elastic. And the exception of the respiratory passage. We said that this is hyaline cartilage, trachea, larynx, all hyaline cartilage except epiglottis. The epiglottis is elastic cartilage. These are the two examples of yellow elastic cartilage. The auricle of the ear and the epiglottis. This in this picture, the green color is the yellow elastic cartilage, the auricle of the ear, and the epiglottis is also green in color. These are the types of cartilages. Thank you for good listening and good luck.